Hello, everyone, and welcome to RevMD Sex Bites podcast with me, your host, Dr. Deborah Durst. So I am an ER physician turned anti-aging regenerative medicine doctor, and my journey took place over about a decade or longer. And in the process of learning all about anti-aging medicine and regenerative medicine, I discovered an entire new field of medicine, which is sexual wellness. It's in a field that's not well known. And by doing this podcast, I want to get the information that I know out to more people and bring special guests on to help them share their information with you too. So again, like, share, subscribe, and let us know what you want to hear more about. But today we have a special guest, Mark White from Gainswave. He is the CEO and founder of Gainswave and Health Gains Clinic in Miami, Florida. And he's here today to give us his story on starting Gainswave and some more valuable information on this incredible service and procedure. So welcome, Mark White.
It's always a pleasure to see you, Doctor. Congratulations on the podcast, and whatever you need, we're here for you.
I know you guys are always completely supportive of your providers and provider network. Love that.
Thanks for having me.
Well, I'm glad that you took time out of your day to be on. So Mark, tell me a little bit about Gainswave and kind of how you got that so well known and so successful in a treatment for erectile dysfunction for men.
Well, first of all, everybody out there is looking for the latest and greatest when it comes to optimizing erections. Viagra is a multi-million-dollar business. And as you know, we own an age management clinic in South Florida. We've been doing that since 2002 called Health Gains. And we treat guys with hormone optimization, testosterone replacement therapy. And in 2014, we added P-shot, because what was happening is guys optimize their testosterone, so they have the sex drive, they have the libido, but they don't realize that having libido and having their penises working are the same thing.
They don't
guys
separate
are coming
that
to us
out.
saying, can you prescribe testosterone, or can you prescribe Viagra? Can you prescribe Cialis? So we were prescribing a lot of Viagra and Cialis, but we were looking for something else. So we heard initially about using PRP in the penis. Mm-hmm. And it's a challenge because when you mention needles and penis in the same sentence to a guy,
mm-hmm. No, they're very hesitant. I will say that if I'm ever at a social event and kind of talking about, or somebody introduces me and says what I do, the first time they hear that, they're like, there's two comments they make. One is they don't need it. And two is they're not going to have an injection in their penis. But they do make their way over later and ask questions. So
they come back to you.
So I agree. I agree with you. They're very hesitant.
And I think this thing, and I hear that all the time, I don't need it. I don't need it because I'm fine down there. But I think this is more about optimizing. So I think the question to ask guys is, what guy wants a better erection? Every guy.
Every guy.
Versus, well, it's not working. And I think that's where the difference comes in, is you want to provide something that lets them optimize their erectile performance. Everybody wants to be better in the bedroom. And I think that's what we do with Gainswave. So going back to your question on how we came up with this, in 2016, we heard about this thing they were doing in Europe using Shockwave therapy for ED. There was an article in Men's Health saying, will this be the next Viagra? And first thing I thought of is, okay, if guys don't like needles on their penis, are they going to like shocks on their penis?
Mm-hmm. It's a good question.
But what I realized is it's not really a shock. It's an acoustic wave. It's a sound wave. Mm-hmm. And we had the clinical studies, and our medical director downloaded all the clinical studies. And he's like, you know what? This might work. Like, guys are getting an 80% success rate with this treatment. So we got an acoustic wave device. These devices have been around for years. Mm-hmm. I know a lot of people have heard of lithotripsy. Lithotripsy is using sound waves to break up kidney stone, highly focused sound waves.
Yes. Yeah.
Chiropractors use sound waves for creating blood flow. So if you ever go to a chiropractor and you have a muscle ache, Sometimes they'll hit you with acoustic waves or shock waves to create more blood in the area, which goes and heals the area.
Okay.
Podiatrists use it for plantar fasciitis.
So there were already lots of uses for it in other areas.
Yeah, it makes me think, like, who would think, okay, it's having all these uses. So some guy somewhere back 10, 12 years ago said, you know what, I'm going to put this on my penis.
Well, they also weren't, at least my understanding was too, there were a lot of military that had been on some medications, right? And, internationally, and then had erectile dysfunction because of that, like the PTSD and meds and psych meds and antidepressants. And then was that how they started using it over there? Was that maybe one of the original?
Okay, so they did it. I know there was an Israeli clinical study. It was around 2008 where they were using shockwave therapy for ED, and they did some trials there. I know that we had a person who was working with us who was a physician's assistant who was in the military. And he said that they used shockwave therapy in the military. I don't know if they were using it for ED.
Okay. All right.
The shockwave therapy has been around for 50 years.
Okay.
It's not new. Mm-hmm. And we know that it works for ED back since 2009. But the question is, why weren't more doctors doing it here? Mm-hmm. So we got the shockwave generator, the acoustic wave device in 2016, and we started treating patients here, and we were treating them for free. They were existing patients who didn't want a P shot or didn't get good results with a P shot, weren't getting good results with Viagra. And every single guy got great results. And I remember the very first guy we did it on, and we didn't know if it was going to work. Mm-hmm. Yeah, we did it, and the next day I come into the office and I have a voicemail from him at 8:30 in the morning. I'm thinking, oh my God, what did we do to this guy? Like, I was scared he was going to yell at us. And he said, Mark, he's like, I don't know what happened, but I had erections all night long for the first time in years.
Wow. That's amazing.
I knew we were onto something. But then the other question, and this is a little bit about my background. As you know, I'm not a doctor. I'm not a medical provider. My background's marketing, building awareness, and also just business operations. So I'm like, how do we tell the story? Because if you tell the story without creating a brand, what happens is, think of PRP. Like, we know PRP works, but because there's no brand around PRP, 99% of the people, the public, don't know that platelet-rich plasma helps heal you or exosomes heal you, because these are not branded products.
And no standardization with
no
those treatments either.
It's a race to the bottom, and then it just becomes something else that nobody's heard of, but some great treatment that just is obscure. So how do the pharmaceutical companies, though, get the word out? They create a patent around the medication, and then they create a trademark around the pill. So they'll trademark the name Viagra, and then they'll market it and get brand awareness so that everybody knows that Viagra exists. So what we did that was a little bit different was, let's trademark Gainswave. Let's teach doctors how to do it so that all the doctors are on the same page. And let us bring brand awareness to this treatment that we know that works. And that's how Gainswave got started. And we now license the Gainswave trademark to about 350 doctors throughout the US. And we help patients. We educate the patients on what it is, why it works, and then we find them a licensed provider near them.
Yeah. And, I love that you were on with me today, because for as many years as I've known you, I didn't know that specific story on, how it started. I knew little bits and pieces, but not all of it. We're always talking about other things, new and exciting things. So
you'll always learn new and exciting things with me.
That's right. I learn something new every time I talk to you or see you. So that's interesting, because again, standardization is key, right? I've had patients come over from kind of, generic knockoff places, very unhappy with their treatments. And the fact that, the Gainswave provider network is, a standardization of treatment protocols for erectile dysfunction is incredible.
And I agree with you. I think, like, what makes if you think of like franchises, like a Starbucks, you can go into a Starbucks anywhere in the world and you know what to expect and you know their brand because they've standardized that. And I think with a medical treatment, it's a little bit more difficult because doctors want to do their own thing. But by educating doctors and providing that training to doctors, we know that our patients will be happy with a Gainswave provider. And if there's not a doctor in our network who's doing the right thing, they don't stay a doctor in our network for long. That's why we know we end up with really good providers.
Yeah, and I think that this is one area of medicine that truly patients come in more proactive than providers and doctors. It's, I say that to them almost on a daily basis because, more providers should be doing it, right? Every urologist should be doing it and they're not. So the fact that patients now, you've educated patients on the treatment, now they come in looking for it. And so that to me, it speaks volumes for what you've done and created here and the fact that there's such a public awareness now.
I also think the psychology of men, typically a guy is not going to go see a cardiologist unless he's having chest pains or unless there's something massive going on. But the moment a guy's penis is not working, he's over there trying to find a treatment because like great sex and great erections is what everybody wants.
Well, and I think that a lot of them don't understand that it isn't all testosterone and hormone optimization. And so even when they go to a urologist with those problems, what do they get? The little blue pill and not often even hormone optimization. But this is a non-invasive way to approach it. So it seems to me a little more acceptable even for those doctors not doing it and definitely the patients. Because again, it's not painful, right? Most men do great with it, with no numbing medicine.
It's not a shock. It's a sound wave. There's no injections. There's no downtime. Doesn't hurt at all. It's just noisy.
Just loud. That's all. We didn't have enough insulation in our office. That's for sure. We didn't anticipate the sound of it at first. So it's always a little loud. We got music playing around those rooms, but I agree. And so basically, with your, kind of educating the public, you guys have a lot of different avenues you do that.
Yeah, I think one is just like what we're doing now with the podcast. We got started, and what really got the ball rolling for us was we were on the Ben Greenfield podcast, who's a very well-known influencer, a biohacker. We were on the Dave Asprey podcast.
I think that's actually how I met you and got introduced to Gainswave. Is I was out in Vegas the time that Ben Greenfield spoke of it, and ended up.
Ben's great.
Yeah, no, and he speaks very highly of it, and also the P shot, which I think again, while men are a little more hesitant to get injections in their penis, they work so well together, and so he talks about that as well, both treatments.
Yeah, and I think every guy who wants to optimize erections, I mean, we know that poor erections are either psychological issues, vascular issues, or hormonal issues. So if a guy can address all of that, especially the hormonal issues, because if you don't have the drive, what good is the erection? If you have the erection and no drive, like either one, they both complement each other. So every guy getting a Gainswave should look at his testosterone levels, optimize his testosterone, and feel like a guy again.
Well, and it's interesting because even in my practice, so they come in either, they'll seek out hormone replacement or testosterone therapy in men. So we'll get appointments based on that. And then that's always opening the door to erectile function and changes they might be experienced because they go hand in hand, right? And so likewise, if I have sexual wellness patients that are coming in for Gainswave, or a P shot, then we're talking about hormones. But I always say, and you can correct me if I'm wrong, but I say 80% of it is hormones, 80% of it is blood flow, 20% hormones, and you can't get sustained results without optimizing the hormones. But again, I think that psychological component you're talking about plays such a huge role when they don't have the confidence of getting an erection and keeping it.
No, I agree with you. It is 80% is vascular. I mean, we know that ED is a blood flow issue.
And so when we talk about that, even when they come in for hormones, again, it doesn't matter how much I optimize their hormones, they're still not going to have the blood flow and again, it's inevitable, right? That eventually will happen, even if it's not happening now. And I think what you speak of, the optimization, optimal performance, it doesn't always have to be such a taboo. I'm doing it because I'm having issues. It could be doing it because maybe there's some mild changes and you don't want to see it progress, right?
I believe like ED is a made up term. This erectile dysfunction is it's like, okay, there's a problem with me. It's dysfunctional. I think it's a term made up by insurance companies. So you can say this is an illness. And I think that's where guys are afraid to talk about it. Oh, I'm not sick. I function okay. But if you ask guys over 40 or 50 years old, do your erections, do you perform in the bedroom the way you did when you're 20 or 25 years old? I think everybody's seen some sort of decrease, like you have with your strength, like you have with your mental acuity. Everything decreases as you age, and it's all about bringing somebody back to that optimal performance.
No, I agree with you. And I think that I term it more functional changes, because I think men are concerned of two big things, performance and function. Mm-hmm. And so I don't like to use the term erectile dysfunction with them in the office. I would rather say functional changes that you might be experiencing. And, again, how common that is and how it increases in incidence with age as well, but more functional changing.
And that's where I think this whole, like what we've seen just in medical is the rise of the functional doctors, the doctor preventive care, and all about keeping people healthy. And you mentioned something earlier about urologists. And I think traditional medicine, the mindset is, if something's not broken, we're not going to fix it.
Mm-hmm.
Like
so they
your car, it's like, okay, I'm not going to maintain my car until my car breaks down. And then I'm going to go to a mechanic to get it fixed. And that's the mentality of, they think, the old school doctor. And I think you've seen this whole trend towards, let's keep your car, let's change the oil, let's keep it clean, let's keep it running so it doesn't break down. And I think functional medicine is the equivalent of the Jiffy Lube.
Exactly. You're trying to, again, get on top of that before you're actually treating a disease or something you would term dysfunction. Men that notice just mild changes, that's the time to come in. And that's what I tell them when we talk about it, especially if they're coming to me for testosterone. Sometimes they're just noticing what you talked about, like a decreased energy or brain fog, or they're not working out at the gym the same. But then when we have the sexual intake questionnaire, then there'll be mild changes. And so that's when we have those discussions, and it's best to start then. You're right, to prevent any further progression.
I've heard another doctor talk about like ED is kind of like this canary in the coal mine, so to speak, where if you're having vascular issues in your penis and your blood flow is decreasing, it's because you have a little bit of blockage, your blood's not flowing. But if your blood's not flowing down there, it's probably not flowing near your heart as well and in your brain as well. So just improving blood flow helps you with, like, we've had guys come into doctors' offices because of ED, and then they'll do a calcium score, PT score, and they'll find that they have a blockage near their heart. So again, that canary in the coal mine, it's indicating that there's another problem that needs to be fixed.
Correct. And I always say, again, we kind of comprehensively, because I do, functional regenerative medicine overall and hormones, and we're tying it all together. But those penile vessels are 1 to 2 millimeters, smallest in the body, barometer of vascular health. And so you're going to notice those functional changes before you notice your coronary arteries at 3 to 4 millimeters or carotids at 5 to 6. That's the first change. Those loss of morning erections, loss of nocturnal erections are a sign of that. And again, Gainswave, even if you wanted to talk about what happens physiologically, Even though I know you're not a doctor, I know you know this better than anyone, that we're telling the tissue it's injured, and then, those endothelial cells get healthy and go to repairing themselves, break off microplaques. Anything else in particular that you want to share as far as what happens after we use that sound wave in the penis and in and around? Again, I say everywhere, the perineum, just not the scrotum. That might be one area, might be discomfort, might have a little discomfort there, but, because we're hitting those larger blood vessels too.
I agree with you. And I think for the guy, you see a lot of guys that once they get that done and they optimize their testosterone, they're going back for maintenance and getting Gainswave maintenance treatments. They feel great. They're just getting great results.
I feel like a lot of men don't like to be without it once they start, meaning that even if we're doing a treatment series, depending on what kind of changes they might be feeling or experiencing, that they like those touch points frequently, where it's that maintenance package. They're doing it once a month or once a quarter or, again, 6 months later. But what do you tell people when they ask if it's a one and done treatment package? Because I have my own little approach to that, but what do you tell them?
First of all, we always point to the studies, and the studies generally are 2 years in length or a year in length. And we do know that after a year to 2 years, they do, it's not a permanent fix. It's not something that it's one and done and you're going to get great erections for the rest of your life. The underlying causes of what caused it, it's still there. You get it done, you clean out the pipes, but then what happens is they still clog up again in a few months or 6 months, a year. So we always recommend maintenance treatments. It's for some guys, it's not convenient, but we recommend they do something.
No, and I have that conversation. It happens that they ask that about a lot of different things, that I do in regenerative medicine. And I always say nothing in life is one and done, right? I mean, you can't fix your car once and it's good forever. You can't change the tires or brakes and they're good forever. And likewise, you want to continue to have healthy blood vessels. And so that continued maintenance is necessary. No,
absolutely. Absolutely. And we also recommend they use some sort of nitrous oxide booster, something to help with the blood flow. There's a lot of nitrous oxide boosters out there. I mean, we're using one down here called Affirm, which was created by a urologist, Dr. Judd Brandeis, and that's a good one. A lot of doctors are doing Gainswave with a penis pump after the session, just like you do with P-Shot, because you want to open up those blood vessels.
Yeah, no, absolutely. Well, we do the penis pump throughout the treatment, just so then if they get bruising, swelling, anything after the P-Shot, which we're usually pairing with it, then they're not blaming it on, specifically the P-Shot or, any Gainswave therapy. We've already been doing it. So It's a great adjunct to it.
It's all integrated.
Yeah, no, absolutely. Comprehensive in the way that it's handled. And so, again, the treatments, only, 20 to 30 minutes, usually about 20, not painful. And you have a couple different devices that you'll recommend in the provider network, right?
So I'll tell you what we've seen, and we've heard this since we started doing this in 2017, 2016, is that guys are very embarrassed to talk about EDs. We are very different from women. A woman, she has vaginal dryness, she talks to her friends, she gets recommendations on who to see. She doesn't mind going somewhere and talking about it. She gets breast augmentation. She's showing her friends.
Well, that part I agree with. The other part I might comment on, but yeah.
Guys don't work like this. I mean, it's every guy you'll talk to will tell you he's perfect. My erections are great. Even though we know that 50% of all guys over 50 have some sort of dysfunction of their penis, because guys are embarrassed and they don't want to go see somebody. So we've always had people, and I think that's why Viagra is so big, is that it's guy can do this from the comfort of his own home. He can take a pill, nobody will ever know. He can order those pills from an online pharmacy. He doesn't even have to talk to his general practitioner. And so we've always had men saying, you know what, is it possible to get a device that I can use in my own house because I want to keep this confidential and private, yet I need to talk to a doctor who's going to help me come up with the treatment plan. So we've been working on that for the last few years. We were looking at different devices, and there were some devices that were out there, but they were either too expensive because they were trying to like make this, like the device you guys use in the office uses air compression. It's a giant device, costs could be anywhere from $20,000 to $50,000. Obviously not in the budget of guys. It's not portable. A couple of years ago, we heard about a urologist who worked on a device using a cam motor, and he put everything into one unit. And that device, he went to market with that called the Phoenix. Mm-hmm. However, it didn't address the need because this was a consumer device. It is a consumer device, works well, but it wasn't being done through doctors. It was more do-it-yourself option, low energy. So in partnership with this company, we created the professional version, the Phoenix Pro. And that can only be, somebody can only get that on a doctor's orders through a Gainswave provider or a trained provider who creates a treatment plan for the patient and is used best when used in conjunction with all the treatments the doctors do. It's not a one and done device intended to replace what you do. It's intended to enhance, accelerate, and it also makes it more cost effective. For example, somebody's going to see you and they're getting 6 Gainswave treatments, and maybe they don't want to come back for maintenance because it's too expensive, those ongoing treatments. But if they combine those in-office Gainswave treatments with at-home treatments they're doing with a home device, and they're using that as maintenance, all of a sudden they're able to get 50 treatments over the course of the next 2 years, 50, 60 treatments through what they're doing in your office and at home for a fraction of the price.
Yes. Yeah. And we recently added that as well, thanks to you. And that was in December, I think. And so again, love the device. And a lot of my men that don't want to pump, it's a great option for them. Some of them just hate the pump. So that was like the first thing we went to is like the men that didn't want to pump. And yet, that's a great adjunct for what we're doing in the office. And then again, it's never going to work alone to do that at home, but there are more touch points in between a maintenance or even while we're doing their series of Gainswave in the office. They can still have those touch points with a pump or the Phoenix Pro at home. It's a great option for them.
Yeah. And I also think what we've seen with the pandemic is that now more patients are looking for a telehealth type setting. Doctors have become more comfortable with it. People don't want to travel. So I think the idea with how to incorporate this product in with a doctor's office is you see the doctor and you do as many in-office treatments as you feel comfortable with. But if you're not comfortable with doing in-office treatments or as many in-office treatments, they're still going to get great results doing at-home treatments.
I agree. They love the device. We've had nothing but positive comments and feedback from it. And again, if they don't like the pump, it's a great option too that they can do instead in conjunction with. But I think even getting back to what we were talking about with, men don't want to talk about it. I completely agree with you. I'm trying to get them away from that concept and instead almost like a badge of honor that they're preventing to the point where they never have to really talk about a real problem. Because they've empowered themselves to actually go get treatments when it's very mild and there's not a huge issue.
Going back to like building that brand awareness, when Viagra started marketing back in 1990, I think it was 95 or 96. Do you remember who their spokesperson was at the time?
No. And what year was that?
It was 1996, and they had Bob Dole.
Oh, gosh. All right.
He was the spokesperson. But when it started to take off, they started getting race car drivers and younger guys talking about it like a badge of honor. And I think how guys need to think about this isn't something to be embarrassed about, because it isn't a dysfunction. It's like, do you want to perform better in all aspects of your life, but especially in the bedroom? And
of course they do. That's a simple one, right?
Yeah. Like a guy should be like, yeah, I got Gainswave and I perform like a rock star.
And that's the thing, like taking it upon themselves at a very mild, and they want to perform optimally, and they do. Mm-hmm. And again, it's more objective. So it's not like they can hide it. Right. And so if there's even that 1 or 2 times when they've had a little alcohol and they can't keep an erection, that alone can prompt, an office visit, which is a great time to start. But you can't hide that from your partner either. And then they lack that confidence, or they get nervous about that ever happening again. And then there's the confidence psychological aspect.
Yeah, it creates like a feedback loop. Once you can't perform, you think, is this going to happen to me again? Then guys will overthink sex too much.
Absolutely. And then I think because we do a lot of women too, and we do half men and half women. Our practice is amazing for that reason. And we do a lot of IV therapy. So that'll get men in the door as well, because sometimes maybe they're a little nervous to approach an office that's only doing one thing, because then everyone knows, right? And so they'll come in and so they're comfortable in the office. But when I talk to them, like, again, for men, it's objective. Everyone can see it, right? Or, it's out there. And so if there's even a mild change that they're thinking about, their partner may be too. And where women, while I agree they are more likely to talk, they won't talk about vaginal dryness. They'll talk about hot flashes, but they don't talk about the fact that they have pain and vaginal dryness, and they tend to still be embarrassed by that. But speaking of women, we've done the acoustic Shockwave Gainswave therapy on multiple many of our female patients. I shouldn't say many, but enough of our female patients. And mainly because I do laser vaginal rejuvenation, but there's a contraindication if you have any implantable device as well. And some people are a little nervous about it. So we've done the we term FemiWave, which has worked great with great results. So a nice option for women too.
I've heard amazing things on using acoustic wave for women. It would be interesting on this home device for women to use it. So the only thing is that we don't have clinical studies on women the same way we do on men. We know it works. I think it would be great to have some objective studies, and definitely it's an option.
Well, I think that we would all in traditional medicine love to have objective studies, but we have to wait a decade sometimes to get them. And that's where I think that patients are more proactive than providers that are still waiting for those studies to come out. But when they do the treatments, they know they work. And so then they get online, they see that other patients are talking about it, both men and women in this field. And then they come in looking for it, right? And so I would love to have the studies to support everything: P-shot, O-shot, Gainswave, FemiWave, vaginal rejuvenation, but we'd have to wait a while, right?
I think if you're going through the FDA and you're going through these 3 phases, it's almost a miracle that they were able to introduce these vaccines in a year, because usually it's a 5-year process.
Yes, correct. And you guys are always gathering information, and you guys always have a study going on. We're always, giving patient, scoring system information back to you guys. And likewise, the Vampire Network or Dr. Runnels group too, to compile data. It's just going to take a while, right?
The Vampire Network.
The Vampire Network. I know. I do like that term though. The fact that we're taking blood, and it's a cool term, but it works so well with it. And that's why when I talk to patients, again, 80% of this being a blood flow issue, Gainswave is awesome at improving blood vessel health and getting healthy blood flow in. And then, likewise, preventing that venous leak that can cause, an erection to go away once you have it. But then also just pairing that, you do a Gainswave, you tell the tissue it's injured, and then you dump a bunch of growth factors in there with PRP. And, of course, there's other options, stem and exosomes, which we've talked about. And I would love to do another podcast in the future talking a little bit more about that. But it's just, they pair so well together. And again, just to maintain optimal performance, what man doesn't want that? Every man does.
I agree.
and again, it comes down to, even if they're starting from a muscle, I'm not as strong, I'm, gaining weight. I'm doing the same thing I always did, where that's a hormone, but that hormone component's small. Of course, you have to have optimization to get sustained results from what we're doing with Gainswave and, P shots, but you got to have both.
Got to have both.
There's no other options, right? And you don't always need the blue pill, right? Bob Dole's blue pill. I didn't know that one either. That's the second thing.
Yeah.
I absolutely learned from you today. More than that, but those are the two big ones, right? I didn't know he was the promoter.
Original promoter. I don't even know if he's still alive.
Yeah, well, I don't know that either, honestly. But so it sounds good. I know Ben's been on there, but there's other big stars that have been, talking and promoting, Gainswave, P shots, all of that. So it's been very helpful, because patients can get online and learn about it and all the results. And
I think our whole thing is just helping educate consumers, because our goal is ultimately to help educated consumers find great doctors like yourself and consistently find other products and services and procedures that work, and continually just bring that brand awareness around them.
And get those, services that work, those out to more patients. You guys are already educating the public, and that happens on a daily basis. Somebody comes in with not something we're directly doing, but something that the Gainswave provider network is, doing for them. And then they come in, and again, just getting more providers to provide the service, getting that out there so they're not waiting necessarily for a study, but instead, catching up with patients and their proactivity on these wonderful services and all the benefits that they obtain from them.
I agree.
I think it's perfect. So I'm glad I met you. And it's been a few years now.
Well, when are you coming back to South Florida?
Well, I think we're coming back in a couple months. We're coming down to your strategic growth workshop.
May 7th.
Yeah, we've been trying to do it for the last couple months, but the timing hasn't been. So yeah, I'll definitely, get in touch with you and make sure you're in town when we're there. Would love to see the office again. Again, Health Gains is a great, beautiful facility that Mark has in South Florida, and it's busy as can be. And we go down there, we learn how to, market and educate patients, but then you can see just this amazing facility at work. And so it helps us take that back to our practices as well.
I would love to go visit you in Knoxville.
Yeah, you need to come up. We do all kinds of stuff, IV therapy, and well, you guys do that down there too. There's nothing that we don't do, but yeah, come up to see the office in Knoxville for sure.
Thank you so much for having me on the show.
Well, thank you so much for taking time out of your day to speak with us. And again, so if you're ever interested in Gainswave, there's information online. You can provide or find a provider near you, provider that's right for you, and get these services that will help, again, prevent any functional changes you might be experiencing as you age. So, and Mark White, thank you so much for being on today with us.
Thank you so much. I really appreciate it.
All right. Well, we'll talk soon. Okay.
Thank you.
Have a great day. Well, once again, I want to thank Mark White for joining us today and sharing all his valuable information with us. And so again, if you want a consult concerning Gainswave or sexual wellness or hormones, anything, then please call the office or send us a text or visit our website and send us a request through that. Like, share, subscribe, and comment, please. Anything you want to hear more about, we're willing to deep dive into anything sexual wellness. And just let me know what you want to hear about and share your experiences, please. So again, we're here to revitalize your look, your health, and your sex life. Thank you.